Halo semua, perkenalkan nama saya Aye Aung dengan NIM G0025183 dari kelompok A1. Di sini saya akan membahas tentang anatomi Vesika Fellea. The bile is produced from the liver and it's stored in the gallbladder. So for the bile to move from the liver to the gallbladder and to the duodenum, it needs to flow through the bile is delivered through the ducts. So here we will learn about the ducts. So in the liver, the liver has ductus hepaticus dexter and ductus hepaticus sinister. The two ducts meets in the middle and becomes the ductus hepaticus communis, which is about 5 centimeters long. And the gallbladder secretes the bile through ductus cysticus. And then the ductus cysticus meets with the ductus hepaticus communis and forms the ductus choledocus, which is about 7 centimeters long. So next we're gonna explain about this part. So this is the pancreas, okay? So this is the pancreas, and the bile duct, which is ductus choledochus, passes the pancreas and meets with the pancreatic duct here, ductus pancreaticus. It meets ductus choledocus, meets with the ductus pancreaticus, and becomes the ampulla hepatopancreatica, which has another name called ampulla vateri. The ampulla vateri enters the duodenum with an opening called papilla duodenum major. So technically, it enters the duodenum's descending part, okay, past descendants of the duodenum, and the opening is called the papilla duodenum major. So the papilla duodenum major is formed by a sphincter. So that sphincter name is musculosphincter OD, and its function is to prevent food from going up to the bile duct. Okay, when the food enters, at some point it's going to reach the duodenum, and since it is an opening, the body makes sure the food doesn't go up the bile duct and to the gallbladder, and it forms a sphincter. So that sphincter is musculosphincter OD, and it is made up of musculosphincter choledochi, musculosphincter ampulla vateri, sama musculosphincter ductus pancreaticus. Okay, so that's all for the anatomy of Vesika Fellea, and we will continue to the diseases. So there are 4 diseases, which are cholelithiasis, acute cholecystitis, choledocholithiasis, and cholelangitis. So each disease has its own symptoms. So we're gonna discuss about that. So the first one is cholelithiasis. Cholelithiasis is the disease that is caused by the presence of the gallstone in the gallbladder. So it is usually asymptomatic. It means it doesn't really show symptoms. But when the symptoms come, it's usually in the form of pain, and the pain is usually in the upper right quadrant of the abdomen. If you don't know, this is the 4 quadrants of the abdomen wall, and also in the gastrium region. And the pain usually radiates to the right scapular, and it can last for 1 to 5 hours. And it also comes with crescendo pattern, which means the pain starts low. You doesn't feel much pain at the start, and the pain, the longer it takes, the longer it becomes, the higher the pain becomes, and at some point it reaches a climax. The pain is really bad, and after that it slows down again. The patient doesn't feel much pain anymore. So that is called crescendo descendo pattern from my understanding, and the pain usually occur after eating fatty or greasy foods. The next one is acute cholecystitis. So the acute cholecystitis is inflammation of the gallbladder. From what I learned, it is caused by a gallstone in acidic gut, and it eventually leads to inflammation of the gallbladder. So it is symptomatic. It has symptoms. It comes with pain, fever, and the pain is similar to cholelithiasis, but it lasts more than 6 hours, and it is more severe and more localized. And the fever is not it's a low-grade fever that is accompanied by nausea and vomiting, diaphoresis. Diaphoresis is the sweating of the body without high temperature in the surrounding, and also tachycardia. And we move on to choledocholithiasis. So the choledocholithiasis is the disease caused by the presence of a gallstone in the bile duct. So the symptoms are pain. It also comes with fever and nausea, and that pain is caused by the biliary obstruction. So the biliary obstruction means because there's a gallstone in the bile duct, the bile is obstructed. It is blocked. The bile cannot move down to the bile duct. It means that. And because of that, the symptoms appear. The jaundice symptom appears. So it's the yellowing of the skin and the eye, and that yellowing can fluctuate because in the bile duct, that gallstone can move up or down, and it can be directly proportional to the appearance of jaundice. And the symptoms could also include pruritus. It is the itching. When choledocholithiasis happens, a patient's urine can become very dark, and the stool can become clay color, and those colors can also fluctuate. When the gallstones are present in the bile duct, the inflammation of the hyper can also happen, which is called hepatitis. Okay, and then we move on to cholangitis. So the cholangitis is caused by the bacterial infection because the bile stone blocks the bile duct. The bile duct becomes inflamed, and that inflammation is because of the bacterial ingestion. So the symptoms include pain, jaundice, fever, which is a high fever. Those three symptoms altogether is called Charcot's triad. And if the Charcot triad is accompanied by hypotension and altered mental status like confusion, it becomes Raynaud's pentats. So these two are like a name given to a cluster of symptoms which cause a certain disease. In this case, cholangitis.